On with the next presenter, which is a Swedish medical technology company, Episurf Medical, and I have the pleasure to introduce the CEO, Pål Ryfors. So, Paul, the word is yours, so take it away.
Thank you very much, Patrick. So good afternoon, everyone. My name is Pål Ryfors, CEO of Episurf Medical. I will provide you with an update of Episurf's business today. And as a start, we have been in business now for about 10 years. We have spent a lot of time and resources on IP, on clinical activities, and we are now really ready to take the next steps on our commercial journey, which will be a key focus for us in 22 and onwards. The pandemic has been a tough period for us, of course, but we have actually essentially doubled the implant portfolio. So we now have well over 1,000 patients treated, and things are looking quite promising for us. The original problem remains. You see a healthy knee on the left side, and an arthritic knee on the right-hand side, where you see there's no joint line. On a normal standing X-ray, you can't see any cartilage. So on the left-hand side, that is what it should look like, but an osteoarthritic knee looks as it does on the right-hand side. And the process leading up to this often starts with a trauma. You might be in your 20s, you get a small hole in the cartilage covering the bone in your knee joint. And year after year, that hole gets bigger. And this is the degenerative process that leads up to osteoarthritis. And this can act quite differently from patient to patient. Some have pain from the start, some have pain now and then, and some people actually don't have pain. But ultimately, a lot of these patients end up on the right-hand side of this graph, where you have knee replacement surgery, which is a relevant option for patients maybe plus 65 years of age and so on. Younger patients up to about 30, 35 years of age, they can be treated with various biological procedures. Could work, especially in the younger patients, but when the patient gets older, there's no gold standard out there. And early intervention implants, often also called small implants, is sort of new phenomena with some perspective in this industry. And Episurf is a market leader in the second generation of these implants, meaning patient-specific implants. Standardized implants for these lesions does not work. And why that is because this is developing implants like this come with significant technical and clinical challenges, and you need to consider the surrounding cartilage, the opposing cartilage, because if the metal implant creates damage on the opposing side, it simply doesn't work. And you also need to consider the subchondral bone, because the pain sits in the bone. There's no pain in the cartilage as such. And we have developed a technology based on three fundamentals, and I will illustrate them on the coming slides here. And I warn you for some invasive images now. But it all starts with the advanced imaging, where we analyze not only the cartilage lesion, but also the underlying bone lesion in our own developed software. This is advanced, and there's no invasive procedure leading up to this procedure. We design a patient-specific implant with perfect, unique anatomy reflection on the curvature of the implant and the depth and positioning, etc. And in the OR, we use patient-specific tools to position the implant in the exact position and at the exact depth that you can see here. So that level of precision you need, and the implant itself is coated with hydroxyapatite and titanium, so it grows into bone, it sits there, and it's one piece implant of cobalt chromium, a normal prosthesis material. So nothing new in that sense, but we know it works and it doesn't break down over time. And it can look in many ways. And this is a patient. You see an extract of our pre-surgical analysis on the left-hand side. You see there's the dark red area reflects a full depth cartilage lesion, and the pink area is a degenerated area, which, a little bit less quality of the cartilage. And underneath the green blob here, that's actually osteonecrosis, so it's dead bone, very painful. And this patient was maybe in his 50s, and this is very challenging to treat with a biological procedure. And a knee replacement on this patient, who has more or less a perfect knee, other than that particular lesion, would be an overtreatment, and this is highly painful. Another lesion in the trochlear area, you see how the actual lesion matches the pre-surgical analysis very well. There's underlying bone lesions, the blue dots you see on the left-hand side here. And you see the quite nice curvature and positioning of this implant fits the unique anatomy of that patient, so that implant will work very well in this knee joint. And the knee joint is exposed to maybe 5-10 times your body weight every time you walk in a stair, so it needs to work in there. And this is a new slide. We have now developed quite a comprehensive product portfolio, actually, and what will drive revenues in the next years. I would highlight that like this. So we have on the knee side, we have the Episealer knee portfolio, which is ready to launch in Europe and certain other markets, and we are conducting a trial in the United States targeting an FDA approval. We have a niche product in that in the knee segment, the patellofemoral system. I'll show you more about that later, but we are actually filing a 510(k) submission later this year. And in our lower extremity portfolio, we have the Episealer Talus, an ankle implant, and we also have in the pipeline an implant for the greater toe, which is a very interesting orthopedic segment as well. So the product portfolio is actually growing, and we have an interesting regulatory strategy reflecting our global ambitions in both Europe, Asia, and also in the United States, of course. And since many years, we've been working actively with an IP strategy, so this is well covered. We have close to 200 units in this portfolio, and it covers everything from imaging, surgical tools, and also the actual implant, of course. So 2 slides that doesn't look very sexy, to be honest, but it shows the volume of clinical evidence we actually have at this point in time. And the preclinical program was extensive within Episurf. And now in the last years, we have really been harvesting on all that work in the sense that we now have several clinical studies published on the Episealer, and the results are really strong. And the sort of hot topic for us in 2021 and 22 is mid to long-term data. And we have a Swedish study published with an average 75 months follow-up with excellent results, where the results of 24 months remain and actually strengthening up to 75 months. And recently, results from a larger study on also 5-year now was presented at 2 clinical congresses. Results of 60 months, and as you can see, the results remain over up to 5 years. So this is highly comforting. And we also know that the implant survival rate, meaning if the implant is still in the knee after a number of years, we have the blue line at the top here. So it looks very promising if you compare it to any other comparable procedure. And if you also take a detailed look at UKA, which is unicompartmental arthroplasty, meaning partial knee replacements for younger patients, you see that the survival rate for our implant actually is much better. So compared to the competition, the Episealer technology works very well. Clinical improvements are significant in the studies. Short rehab and fast return to weight bearing, and given the pre-surgical analysis that we are engaged in, the surgeon is provided with predictable results because he or she knows that this particular implant will fit this particular patient very, very well. And on the right-hand side, you actually see a movie from the five-year follow-up of our very first patient who was treated late 2012. So next year he's 10 years out. So look out for more news on that. So the US market is the single biggest orthopedic market in the world. We have taken some important steps, but what we have ahead of us is a PMA strategy for the Episealer knee portfolio. We have a 510(k) strategy for the Episealer patellofemoral system, which is a knee implant system I'll show you in a minute. And also a 510(k) strategy for the Episealer MTP system, which is the greater toe. And if you look at the patellofemoral product for a second, about 18-20% of anyone who has osteoarthritis, they actually have osteoarthritis in the part of the knee which is called the patellofemoral compartment. And this is a 2-implant system, meaning that we have 1 implant in the patella and 1 implant in the trochlea area of the knee. And this will be an individualized implant based on the same technology as we have in Europe. But given the fact that this is a 2-component system, we can go for a 510(k) submission instead of a PMA. And we are, as I mentioned, looking at filing that later this year, meaning we have a few more days to do that. If you look at the MTP joint, This is a big problem. About 2.5% of anyone above 50 years old in the United States suffer from this, and you get a stiff toe, painful toe, and this often leads to fusion. So fusion means that you will get rid of the pain, but you don't have a well-functioning toe at all. And there are many implant solutions out there, but our research tells us that they rarely work, so there's no clear winner. And we've been thinking about this for some time, and earlier this year we announced our intention of launching an implant system for the MTP joint, and we think that with our unique approach and individualized implants and surgical tools, we can provide the market with a very, very competitive offering. So this is in the pipeline, and we are hopefully filing a 510K late 2022, might be first half of 23. We are yet to confirm the final timetable, but it's about 1 year later than the Episealer patellofemoral product. And as you can see on this scale here, we're talking about dorsiflexion. And when you come down below, 45% and lower, you are on the osteoarthritis scale, so to say. And patients need motion in the graded toe, and this is the challenge that we are set out to address with our implant system, and we look forward to update the market on our progress. We've also launched the Episealer Talus product in 2020. The early feedback is excellent, and you see that this is an implant for a very challenging joint. And the talus bone, you get osteoarthritis and you get severe ankle bone lesions in this joint. So this is a difficult joint to treat, and the access is a big challenge. But without surgical tools, we have solved that problem. And on a very light note, we can have a look at one patient who was treated late May 2021, and this is a movie from August. She's been in heavy pain for many years, one of the first ones in Europe to get this implant. So this was not an easy case for this particular surgeon. She's now a few months after surgery. She was actually pain-free. We have one study published, which is a case report on a 5-year follow-up from this patient, from a patient with this implant. And we are very hopeful about seeing additional clinical evidence on larger cohorts in the future. And this is the right ankle she was treated in, I should say. So focus areas for Episurf going forward. Episealer knee, we're focusing on increased commercial activities in Europe and certain other markets in the Middle East and Asia in the next years. That's a top priority for us. We're continuing with our trial in the United States, the EPIC knee trial in our PMA process targeted in 24-25, patient recruitment and then patient follow-up, key activities. We are launching the Episealer Talus in Europe and certain other markets, and we're also running a couple of studies in Europe or supporting a couple of studies in Europe on this particular product. So that's interesting. The Episealer patellofemoral system being filed hopefully now this year, December, and launched realistically mid-2022 on the US market. And about a year later, we have the Episealer MTP system for the US market in the pipeline. We have not yet taken a decision on the Episealer Talus for the US market, so you can look out for that. But the first 5 rows of this slide are very interesting in itself and sort of more than enough for the next year. So strategy and targets, clinical data, reimbursement, global establishment, and developing this technology have always been top priorities for us from a strategic perspective, and we're continuing to do that. Up to FDA approval, and I'm talking about the bigger Episealer knee portfolio then, we're focusing on significant growth in the markets where we can market the technology. We need to continue to expand the portfolio of clinical evidence, and we need to secure full market access in all our markets, meaning we have reimbursement and all market activities sort of sorted. And we need to constantly make sure that we are top of the line when you look at the technology we have developed, and we think we are well covered there. So long term, this is a market worth, in our opinion, well over $1 billion. And long term, we're looking at a 30% market share in this industry. And we have also said that 3 years after FDA approval, we want to reach a 15% market share in all our target markets. Top 10 shareholders adjusted for the most recent directed issue we conducted. So Ilya Batlyan is the largest shareholder with 13%. And we have several shareholders who've been with us for many years. And last year, 2020, we added fourth, second, and third pension fund, etc., in Sweden. So you can have a look at this on our website. So as a summary, what are we happy about? Start with that. So we are growing despite COVID. Elective surgery has had a very tough time during the pandemic. Experimental elective surgery, possibly even worse. But we are growing. We've done business in 15 countries, so the regulatory framework is in place in a lot of countries. We've hired a head of sales outside of the US and a president for Episurf Medical Inc. in recent months. So very important commercially driven additions to the organization. We have our first 510K product underway and the second one in the pipeline. We're well-funded, strong clinical track record, especially in the recent year, and Episilitalis has received excellent feedback. So all of this provides a lot of confidence for us, and we're also seeing the last point here that we believe there's a paradigm shift in the industry ongoing. And the type of attention we receive, the type of questions we get at clinical congresses, the early intervention implants are becoming accepted. So on the negative side, COVID, not much to do about. It's tough, but we will get through it. The EPIC knee study needs more attention from us, and we need to improve the commercial strategy now, and we have taken measures to do just that. So in the next months, if you look at the short term, I would look out for the 510K submission. I would look out for more 5-year data. I will look out for more updates on our commercial strategy and also what we're doing in the UK with the reimbursement process that we are working with in the UK market. So that's everything from me, and open up for a Q&A. Thank you very much.
Great, thank you, Paul. I'm actually gonna start with one question here, and that's about the 510K that you're gonna file now. You have about 2 weeks left of the year to do that. But how come that you can file that one with a 510K? Is it because it's a 2-part system and they're already existing that, or is it because it's less weight bearing and the authorities are afraid of, you know, having metal against metal is less of a risk than having metal against cartilage?
So there's obviously a lot of details in this application and analysis, but there's one factor that overrules them all, and that is the fact that this is a 2-component system, as you mentioned. There are no implants approved on the US market that doesn't have 2 components. So what we do in Europe with a metal implant or an implant, for that sake, that articulates against cartilage on the opposing side, is the sort of biggest headache for the FDA. It's a question that our surgeons ask us: what happens to the opposing cartilage? And we need to demonstrate that the implant doesn't harm the opposing cartilage. And we're doing that. We've seen that from anything from animal studies up to the clinical trials we've been conducting in Europe. So we're confident about that. However, we need to prove that to the FDA, and again, there are no implants like that approved in the US market, but a 2-component system is well known, well proven, and that's a 510K classification for that one.
Okay, great. So assuming that you get the 510K approval and you get or clearance rather, and you get it so you can launch the product in mid-22, could you say a little bit about your commercial strategy, how you're going to go about in the US to sell the system or sell the product?
So the US market, I think most of the orthopedic companies, they work with a combination of own reps and distributors, because you have independent distributor networks in the US that are very powerful in regions. So I believe we will start with the combination. Patrick Jamnick just joined as the president in the US, and we are currently working on this strategy. I wouldn't exclude anything if you look at larger corporations or partnerships, or if we hired to some degree an own sales force. I will have to come back with the details on that. We have a strong network through, if you look at our board, our advisory group, our president in the US, and also the sites that we're working with in the EPIC knee trial. So we have a good platform to work from. but I will have to come back with the details about the commercial strategy.
Okay, great. Then, I mean, you have focused very much over the last couple of years to produce a lot of new clinical data, because you basically didn't have clinical data initially. So would you say that you really feel that the perception of your system, of your product, is changing to the better? Is this really what the surgeons were looking for?
Oh yes, absolutely. And there's, I say that with a smile, because in the company, it was a big clinical congress now 2 weeks ago, ISAKOS, for example, and these kind of implants, because we have some competitors which supply standardized implants. It was a significant agenda point, and well-known key opinion leaders globally were discussing and evaluating this, and we are being accepted in rooms that we couldn't even get access to just a few years ago. So we're definitely seeing that. You might say it's more of a feeling, but you see small steps, you get small invitations, you get someone says something, and all of that leads up to a certain gut feeling, and it's definitely a positive one for us. Of course, shareholders would like to see that in the numbers, and I'm confident that we will deliver, because it's absolutely becoming more and more accepted with this kind of implants. And the skepticism, I mean, it's a healthy skepticism, and it's a huge opportunity. But there's a huge patient group out there that simply doesn't have a good option right now. And being 46 years old, being told to either wait 10 or 15 years from knee replacement, or being actually provided with a total knee replacement, that's, these are not good options. So the burden of proof is high for someone like us. We're delivering on it, and we see that the acceptance for us is absolutely growing. I would say that.
Great. In the interest of time, I'm just going to ask you one more question. Do you see the same type of acceptance or interest from other big orthopedic companies as you do from key opinion leaders?
Yeah, I mean, in general, we have learned the hard way that when we spoke to the industry 5 years ago, we learned the hard way that we were very early. And the big players want to see two things: clinical evidence and realistic strategy to the US market. So we have addressed those two in a firm way. And there are definitely people in the bigger organizations that are seeing what we're doing. And we see, again, smaller things, but posts on LinkedIn and other things where they talk about personalization, individualization, and also having a strong alternative to bridge a patient into a total knee replacement. And we see that they respect us because we are a relevant player in this field. So absolutely. What that means, that's another story, but absolutely. And just to see, final comment on that, we hired Stephen Caswell as head of sales out of the US now. He has been instrumental in driving Mako, the robotic surgery arm for Stryker in the UK market. He is someone who has seen this from the other side of the table, so to say, and there are many more like him out there. So I feel the acceptance also coming from that direction.
Great, Paul. It looks like we have a very exciting 2022 to look forward to. Good luck. You do still have some work to do if you're going to file here before New Year's, but good luck, and thank you very much for taking the time speaking to us today. I think it's time to shift over to the next presentation. But again, thank you.